Holes.
Look at the size of those hypoglossal canals. I can see it right through here. It's magnetized, so nice. It's magnetized. Okay, so I'm going to holes first. I need out. So what happened to that sphenoid bone you had before? You took it back?
They took, I don't know if she took it.
Can someone get the sphenoid ethmoid bone, please? Little box. Especially with the holes, because some things are not on all the bones. Come on down.
Go.
So you want to hear it all too. Okay. We'll do the holes first, per request. Most of these holes are on the sphenoid bone and in the skull. I'm doing right now on the sphenoid bone, except for one. All right. I'm start with the one. This here is your sella turcica on your sphenoid bone. It means saddle. Okay. On the base of the saddle, you have two holes where you put your feet if you're riding a horse. It's your foramen lastrum. It serves no purpose whatsoever. It just connects the sphenoid bone with the temporal bone. Nothing goes through there. It serves no purposes. One more thing to memorize for your test that's not necessary. Foramen lastrum, okay? And it's only on the skull. On the sphenoid bone itself, it is only a notch. So you really can't ask you about the foramen lastrum on the sphenoid bone. The other foramens, yes, they can. So we'll use the Costa-approved method of rows. All right. Rows means R is your foramen rotundum, which is right under the lesser wings, also on the sphenoid bone itself. O is your foramen ovale, which is oval shaped, hence the name ovale. And right below that is your foramen spinosum. The spinosum word has an I in it. The I has a dot on it. The small dot is the dot that's over here, spinosum, okay? You also have here, you have fissures. Your superior orbital fissure, all right? It's right below the lesser wings on the skull and below the lesser wings on the sphenoid bone itself. It's called a fissure because it's not a hole, it's a long crack. You have an earthquake, the ground opens up, you don't get a hole, you get a fissure. From this view, looking down into the skull, you can only see the superior orbital fissure from the superior view. You cannot see the inferior orbital fissure. Again, right below the lesser wings. If you turn upside down, all right, now you can see only the inferior orbital fissure from the inferior view. So you can't get confused. Inferior, if it's like this, like that, you're going to say inferior orbital fissure. If you're looking this way, you'll say superior orbital fissure. You can only see both of them looking through the eye itself, the orbit of the eye. Hopefully you know your superior from inferior. Top one is going to be superior orbital fissure, bottom will be inferior orbital fissure. But here you have both. Here you only have one superior, and here you only have one inferior, okay? You also have your optic canal, which goes through your eye. It's for your optic nerve to go through, okay? It's on the skull. It's also on the sphenoid bone itself, okay? So it's on both. I'm going to show you both of these for that. Okay, so staying on the superior part of the skull, this here is your petrous portion of your temporal bone. In the superior view, going through here, you have your internal acoustic canal, acoustic meatus, whatever your professor decides to call it. Internal acoustic canal. On the superior view, put my finger here, is the external acoustic canal. In real life, this is a hole. It doesn't stop here. Only on these skulls it does. You wouldn't hear anything if it did, okay? Internal acoustic canal, external acoustic canal. Again, right below that is your large foramen, your jugular foramen. Looks like a J or a jelly bean. So think of jelly bean, J, jugular foramen. Very large because your jugular vein goes through there, the vampire vein. Also cranial nerves 9, 10, and 11. So a lot of things going through there needs to be a bigger hole. Jugular foramen, okay? This is your biggest hole. This is your foramen magnum. where your spinal cord goes through, your brainstem goes through. On the sides here, although definitely not as big on your skull as on my skull, is your hypoglossal canal. On the base of the hole for the foramen magnum, on the sides of it, is your hypoglossal canal. Your hypoglossal nerve goes through the hypoglossal canal, okay? Both sides. As we turn it over, here's your jugular foramen again. I'm on the inferior view. On the inferior view, right above it is going to be your carotid canal. Your carotid artery goes through there. Again, in real life, it goes all the way through. It doesn't stop here. You wouldn't have any blood supply to your brain. It goes through the bottom and comes up the petrous portion on a real skull on the temporal bone. All right, so staying on here, these are your incisor teeth. All right, in here is your incisive fossa. Not everybody has to know that, but some people do. Right at the roof of your mouth, right before your teeth, the incisive fossa. This is your styloid process. Anything styloid is going to be pointy, like stiletto heels. Stiletto styloid, very simple. This is your mastoid process, like the stiletto heel and like a man's boot. So styloid process, mastoid process. Between them is another hole, your stylomastoid foramen. Stylomastoid foramen. My mother told me that women come first. That's why it's not called the mastostyloid foramen. It's called the stylomastoid foramen. Between the two of them, the only aptly named hole on the entire skull. Okay. What other holes we got here? Okay, so on your orbit of your eye. Now you won't see this on your skull, but there they are. The things you never see is your supraorbital foramen. They actually are holes. On your skulls, and probably the skull you're going to see in your class, they're going to be notches. This represents the supraorbital foramen. Is this notch here on both sides. If you're lucky enough to have this skull, you'll actually have a hole there. It's actually called a supraorbital notch or foramen. They usually call it foramen. Infraorbital foramen is, again, super is above, orbital is the eye, above the eye, infra is below the eye. These are actually holes. Your infraorbital foramen, okay, below the eye. You also have holes at the base of your nose. This is called your lacrimal duct, lacrimal canal, however else your teacher decides to call it. That's where your teardrops come. When you get your A's on your test after all this stuff, you cry your tears of joy, that's what they're going to come out of, okay? It's right at the base of the lacrimal bone, which has a groove in it, which you can see on this skull easier. Little groove coming down from the lacrimal bone into the lacrimal duct or canal, okay? Let's see, carotid, okay, this is your ethmoid bone. It's at the front part of your skull up here. You can only see part of it on the skull itself. The ethmoid bone itself has things you cannot see on the skull. This actually has a very nice crista galli, which holds your brain in place, helps to hold your brain in place. The cribriform plate is the plate right at the base of the crista galli. It's a plate. It has holes in it, which this one does have holes. Olfactory foramina. Your olfactory nerve goes through there, and also it brings up smells. It's like a ventilation system for smells going to your brain. If you smelled my cooking last night, you'd know how important the olfactory foramina are. And on the ethmoid bone, staying with the ethmoid bone, inside your nose you have 3 sets of bones called the nasal concha. The direct airflow. You have on the skull itself, you have your inferior nasal concha, or concha, whatever they want to call it, at the bottom. And at the top you have your middle nasal concha. There are no superior nasal concha on the skull itself, although we do have superior nasal concha. Inferior and middle on the skull. On the ethmoid bone is where you find your other nasal concha. The middle plate here is called your perpendicular plate. It's what forms part of the bony nasal septum. Right next to the plate is your middle nasal concha again. The top ones here are the bottom ones here. Right next to your perpendicular plate. Right above them are your superior nasal concha. which are not visible on the skull because it's a closed-in piece, fused bone. So you can only see the middle and the inferior on here. And on the ethmoid bone, you can see the middle and the superior. If by some chance your professor uses this skull, which most of them do not, all three of the concha are visible on this, because you can see the ethmoid bone right through here. Your inferior, again, your middle on either side of the perpendicular plate, and your superior ones on top. Perpendicular plate is the top part of this bone in here. The bottom part is called the vomer. Those bones together make up the bony nasal septum. That can be a question on your test with no models on the table. Just what two bones make up the bony nasal septum? You should know them. Perpendicular plate of the ethmoid bone and the vomer. Okay? Inside your eye, making up the orbit of the eye, are 7 bones. This is another question that could be a question on a test with no models being available. Name the 7 bones that make up the orbit of the eye. Much easier to see on here, on the skull here. Your frontal bone is your bone in the front. On the side here is your zygomatic bone. Okay? Right next to that is your orbital surface of your sphenoid bone. Across from that is going to be your lateral mass or your orbital surface of your ethmoid bone. You also have your lacrimal bone, your maxilla bone, and deep inside here is a little tiny triangular shaped red bone is called the palatine bone. Those are the 7 bones that make up the orbit of the eye. This can be a question without any models present, just so you know. Okay? Also on here, on your cheekbone here, this is where the temporal bone and the zygomatic bone meet. Temporal bone is this brown bone here. Zygomatic bone is this yellow bone here. Looks like Texas. They both have processes. On the temporal bone, you have the zygomatic process of the temporal bone. On the zygomatic bone, you have the temporal process of the zygomatic bone, named by the bone that they attach to, not the bone they come from. Together they make the zygomatic arch. Can also be a question on a test with no models present. Remember, zygomatic process of the temporal bone, temporal process of the zygomatic bone. Okay? Okay, let's see now. What else we got on here? You have on the back here, the bump in the back of your head. This is called the external occipital protuberance. EOP for those that have a nice teacher. EOP. EOP, external occipital protuberance. Coming up from the protuberance, going inferiorly, is the external occipital crest. Don't always ask that. They prefer the internal occipital crest, which is much easier to see. Okay? You have right here, where this sticker is a part called the glabella. The sticker won't be there, so look on here. Right between your eyebrow bones, which have no name, eyebrow bones. Your glabella. Okay? Let's just go back to the sphenoid bone for a second. Sphenoid bone and ethmoid bone are usually taught together. They have very similar sounding names. Ethmoid, sphenoid, and right near each other. It wouldn't matter so much. They both have a sinus. This is like a giant owl attacking you with his little wings coming out, little legs coming out here. Sphenoid bone. Say it on the test there. Sphenoid, sphenoid, sphenoid. Inside the eyes is your sphenoid sinus. Okay, your sphenoid sinus. Inside the eyes of this bone is your sphenoid sinus. Inside the eyes of the holes next to the crista galli is your ethmoid sinus. It's a hell of a way to lose 4 points by missing up the bones. I mess it up myself when I'm talking about it, so try to remember what bone you're looking at. Say ethmoid, ethmoid, ethmoid sinus. Sphenoid, sphenoid, sphenoid sinus. On the sphenoid bone, here you can see your lesser wings, to the smaller wings on top. Your greater wings are the greater wings below them. Bigger, they're bigger wings. This here is your orbital surface. This is the part that makes up the orbit of your eye. It sits on your head like that, okay? You have here two processes, pterygoid processes. The P is silent, like pterodactyl, for those that watch Jurassic Park. Pterygoid processes. At the base of the pterygoid processes are the pterygoid plates. Medial on the inside, lateral on the outside. If they put a sticker over here, you write down plate, you'll probably be marked wrong. It's a pterygoid process, the whole thing. If they put a sticker here on the end of it, and they want you to say pterygoid process, and you say lateral pterygoid plate, you should be marked correct. That really is even more information than they asked for. Lateral pterygoid plates, medial pterygoid plate, pterygoid process. Again, this is your sella turcica, or saddle bone. There's a fossa here. It's called the hypophyseal fossa, or hypophyseal fossa. This is where the pituitary gland sits. The other name for the pituitary gland is the hypophysis. Now you know why it's called the hypophyseal fossa. I wish it was called the pituitary fossa, but it's not. So don't make that mistake. So your body. Again, they don't really ask bodies on these tests too often because a lot of things have bodies on them. And again, through here, don't forget you have your optic canals on the sphenoid bone itself. Okay? And all the frames I mentioned before on the skull, the foramen ovale, foramen spinosum, foramen rotundum, and your superior orbital fissure are all part of this bone as well as the skull bone. Just no foramen lacerum. Who cares? It serves no purpose anyway. Oh, you guys aren't taping, are you? Oh, just kidding. Ethmoid bone. This is the way it sits in your head. The crista galli is anterior and superior. It sits like that. Crista galli is the little point here. Again, it attaches, helps you attach the base of your brain to your skull so you don't lose it, like I did. Right below that is your cribriform plate. On my skull, not your skulls, there are holes in the cribriform plate called the olfactory foramina. The cribriform plate is like a colander. Being a chef, I use a colander every single day. It has holes in it. The holes in the colander represent the olfactory foramina. The colander itself represents the cribriform plate. These lateral masses here, or orbital surface of your ethmoid bone, what makes up the orbit of your eye, this is the ethmoid part of it. Middle plate here, again, is your perpendicular plate of the ethmoid bone. Again, it meets with the vomer to make up the bony nasal septum down the middle of your nose here. Here are your superior nasal concha, your middle nasal concha. Remember, there are no inferior nasal concha on the ethmoid bone itself, only on the skull. And on the front view here, here's your perpendicular plate. Here is your middle nasal concha. Here's your superior nasal concha of the ethmoid bone. Ethmoid sinus, not sphenoid sinus, ethmoid sinus on here. All right. Temporal bone can be shown separately on the test. Remember from your first test you had these lovely tissues called the squamous epithelium, which nobody can find under the microscope. Squamous means flattened. The flattened part of your temporal bone is the squamous portion of your temporal bone. The elevated portion is your petrous portion of your temporal bone. Okay? Again, here is your external acoustic or auditory canal. Here is your carotid canal, which goes through on this bone, like it's supposed to. Here is your styloid process. Here is your mastoid process. Here is your stylomastoid foramen. Here is your zygomatic process of the temporal bone. All on here separately. Okay, let's see what else we got here. We have, yes. By your teeth, you have little pouches, which are also on the mandible itself. These are called your alveolar processes. They are the pouches that the teeth go into. This is called your anterior nasal spine. It's actually the point of the vomer. Anterior nasal spine, the point of your vomer. The vomer's here. The point is your anterior nasal spine. Your nasal bones are up here. They're not part of your orbit of your eye. All right. To go to the, in case you guys don't know these bones, I should go over these bones. This is the front of the skull. This is your frontal bone. Makes sense. Parietal bones. Know your left from your right, so know which way the skull's supposed to face. Occipital bone in the back. You have your sagittal suture going down the middle. Remember, sagittal cut from lab number 1 divides the body in half. Your coronal suture, like a crown on your head, it goes around across the front of your skull. On the back is the oddly named lambdoidal suture, which I would have called occipital suture myself, but wasn't my choice. Lambdoidal suture. On the side here, you see part of on this skull cap, or the calvaria, is part of your squamosal suture, which surrounds the squamosal part of your temporal bone. It makes sense. Squamosal portion, squamosal suture. Those should be the only 4 sutures you usually have to know. There are others, many others, which you can look up on your own if you need to look at them.
Yeah, that's the only 4 sutures I think.
They should be. They should be. So I'll now open the floor to questions or things I might have forgotten. Feel free. No questions?